Did you know that having type 2 diabetes increases your risk of colon cancer? I'm Stephanie, I'm a nurse practitioner and type 2 diabetic, and I'm here to help you avoid the long-term complications from type 2 diabetes. So I'm getting ready to do my bowel prep. I've always feared this part, but I'm 46 years old, and anyone over 45, you should be getting a colonoscopy. Usually it's once every 10 years, but if you have a family history of colon cancer, then it's going to be more frequent. And you should get it earlier if you have a family history and if you have any problems going to the bathroom. Colon cancer is one of these things that is really preventable and treatable when caught early. And as a type 2 diabetic, we are more at risk. Some studies show 47% more at risk to developing colon cancer versus someone without type 2 diabetes. And so why is that risk there? Well, the cancer likes a high glucose environment. And so as a type 2 diabetic, especially if you're not controlled, you already have a lot of glucose on board. And that glucose just fuels the growth of those cancer cells because it likes to feed on that. And then you have the role of insulin. Insulin is actually a growth hormone. And when you have insulin on board, you have extra cells that are in there that are abnormal along with your normal cells that insulin can bind to and open the cell door so that glucose can get in, but also it likes to increase the cells as well because it's a growth factor, right? And so it's very, very important if you're type 2 diabetic, and especially if you're African American, because your risk goes up even more to get those colonoscopies.